Good afternoon. So today we're going to be talking about on this video assignment about the nurse informatics for Forum 2. Um, so as we all know, um, our nurses are what we call the heart of healthcare. They are between front and backbone of patient care. I do work for an OBGYN clinic and working with the nurses, they are the ones that keep the glue together between the front desk and the providers in the back. Um, Also, their involvement in changes and how any informatics can relate barrier or benefit can affect the care of each patient in their working environment. As we all know, everything keeps changing in the health department. Um, as well as the technology that's being used in that area. At the clinic I work at, communication is a major quality to provide for best care to our patients. We have different points of communication that we have been upgrading throughout the company. So these different points are the HEIQ, which allows out to communicate between providers, staff, and nurses. That is a more professional point to where we can upload the patient's information, more information than what we could do on another, um, like Skype or Teams. Microsoft Teams chat. So the only thing about the HiQ is that it deletes after a few days. So let's say a provider sends us information about a patient that needs to be scheduled or that needs to have some type of treatment on Friday. By Monday, that'll be deleted. That is the only problem about the high queue, and information can be lost. Another one, as I was mentioning earlier, the Microsoft Teams chat is a freer and more friendly chat. This is also available to communicate in between employees. So that's more like I don't want to say social media application, but it's more free to um, put more friendlier. We can also use emojis on there. It can be more of a fun chat for the team. Walkie talkies have been implemented for the MOAs, having more patient care access, have walkie talkies to call the providers when they need help. Also, Zoom meetings, MyChart usage, virtual appointments. Those have been things that have been very helpful for patients and providers in time of patient care. The nurses are also big on using the MyChart, the Zoom meetings, and also virtual appointments for like the nurses on the GDN side of things. These changes have made it a bit more organized for the providers and employers. That way, if anything needs to be addressed, they can be reached out sooner. So the providers have the high queue on their phones. They can be contacted on there unless they are on a busier, let's say they're on surgery or something like that. They can communicate it on there, put busy or put that they're on a surgery. That way we know not to bother them at that time. Information system can be used at our advantage as they keep revolutionizing and upgrading to a way that can be beneficial to all nurses and all staff involved. According to our textbook, nursing informatics is still in its infancy as is technology that the INS uses on a daily basis. So there is more. There can be more upgrade, more tools that patients can use to communicate with their providers in a way that it's not going to be um, too difficult for them to get adapted to. Um, with all the upgrades, there are many errors that could be avoided, but still human errors are common. Finding barriers in the working environment can lead to finding a future way to improve those barriers and have a better system. Even though our clinic does not hold a nurse informatics member, we do see what the struggle can be to do what they do and have information in a timely manner. So, Our clinic, because it belongs to a bigger company, a bigger organization, we do not have an informatics member. Everything is within UT Southwestern. So it's not something that just anybody can be involved. We have like an IT tech. Um, um, what's it called, department, that they are the ones that we communicate with, and they help us with whatever upgrade or whatever training we need. So some barriers that we come across as medication errors involving evolving technology, quality of care due to staffing issues, staffing shortage, due to budgeting, HIPAA violations, paper signed or electronic, and lastly, passion. So the medication errors, dispensing of the wrong medications is very common. How can that be avoided? Um, some clinics do have dispensers of medication that have also um, given the wrong medication for a specific provider. A specific patient. As of now, there have been dispensers used to provide patients with their medications, but even then, it is common and easy to make mistakes. Evolving technology. As we know, technology has evolved in many ways, from cell phones to computers to medical advances. Even then, adapting to a new system can be hard for old school nurses and staff. We do have those in the clinic where it's very hard for them to um, um, adapt to the new changes when we have like an upgrade on the system. Quality of care due to staffing, shortage of clinical staff has been very difficult in the past 4 years, especially due to the whole COVID situation. Um, so there has been issues with staffing for so long, but since the pandemic happened, it seems the shortage has been higher. This has limited the quality of care, but has increased the quantity of patients visiting clinics and hospitals. So job vacancies for various types of nursing personnel increased by a 30% between 2019 and 2020, according to an analysis of AHA survey data. Since then, the shortages have been such that even clinics are suffering the hit staff shortage, and this has affected the care in all areas. So, for us to provide the best care there is, we need to have the staffing, but at the same time, um, the budgeting has been limited as well for us to be for us to to hire those extra employees. So HIPAA violations, is it better to have a HIPAA forms, or are they better in paper form? I'm sorry, in electronic form. As healthcare is implementing advanced technology systems, patients can now sign their consent forms electronically. Is this way the best way? Even though this form is not online on a MyChart portal, this can cause a problem if we are not sure of the person signing the form as the actual patient. So we need to make sure that the patient signing the HIPAA form is the patient that is actually going to see the provider. If we do implement it on an electronical or in an electronic base, how do we know if that is actual patient? Or is somebody else trying to sign this document? And lastly, passion. Some of the passion has died down in the field. Passion has to be back in the employees to provide the best care there is. Even with shortage of staffing, if there is no passion, there is no best care. We need to provide that quality of care, showing the patient that we do care, that we have that passion for caring for them. And I can sense and I can see it where I work, that that passion is no longer there for most some of the people there. There are many benefits in nursing informatics that can be utilized not only in the medical setting, but also as patients. The HIMSS Nursing Informatics Workforce Survey indicates that over two-thirds, 68% of the survey respondents, work for a hospital or multi-facility health system in an informatics role. The new platform have been formatted so that they can be useful to patients and be more convenient for them and providers. So to close this video, I have to say that everything points out to being um, helpful for patients and providers and all of us in between. So for nurse informatics, I think that we are on a good road to get there, where everything would be um, more better for the patient and the providers. Now with virtual visits, that's a lot of help for the providers that are booking months and months out. But at the same time, with those type of visits, it helps the patient get the care, or at least get advice on what to do when they need it most.